every day people come to me in the emergency department and they say, "Oh, Dr. Khan, will you be my doctor?" And I say, first, I can't be a doctor. I'm an emergency doctor. Not say I'm so great. So this is in comparison, right? And then I say, "Well, isn't this your doctor? It doesn't say this is your." "Oh, I don't like him. Oh, I don't like her." Or they just don't listen to me. They don't understand me. And so at the same time, I was going through this clinical epidemiology program, and I decided to do this as my project. I came up with a system, or I hope I came up with a system, that's going to help you find the doctor that's right for you. Because what I found was that we all have, I guess I could show my little picture of, right? We all have different personal and medical needs, right? I mean, the person that's right for me is not the person that's right for you or you. Even though we're in the same field, you're my coworker, you're my mother, you're my sister, we're very different on how we communicate. Social networks are very important in making those decisions, but they're not actually, what we found in the research is that it's not actually the end-all and be-all of why you make your healthcare decisions the way you do. So, what is DocMatcher? We help you find, connect, and communicate with a doctor. We're trying to make the healthcare experience more like your everyday life. What I want you to do is be able to go on DocMatcher and live your life. Okay? So you're just living your normal day life, you go into work, you're taking care of your kids, or whatever it is you do, and then, oh, by the way, my asthma's acting up. And oh, by the way, I got to make that stupid appointment with my doctor. And not use the emergency department for everything. That's one of my goals, but we'll see if I get there. Okay. So what we've done is we have created, and still on the process of refining, a formula that helps you find the doctor that's right for you. Hence, DocMatcher.com, right? Facebook means online health, online dating for health. We have taken a few factors that we feel that are important, and this is all research-based. Quality care, comfort, convenience, and cost we find are the most important, and we have, if I told you this, I'd have to kill you kind of a thing, but we are building a formula that we think works. I'm trying to get to be the Netflix, eventually, of matching. I actually just hired this fantastic statistician. I love the man. I worked with him during my research fellowship at Cornell, and I mean, the things that this man can do with numbers, I can't add, by the way. So I always have a little calculator at work, don't worry. So this is one of my goals. I know there's a lot of bad talk about doctors and things like that, but doctors aren't generally bad people. Some of them are, let me tell you. Some of the people I went to medical school, I wouldn't stand in the same room with them. Because there is a mindset, and then medical school changes you as a person. It really just takes away all the interests and things that you used to do, and it just sucks your life dry. And I'm sure that's true for nursing school and all these other things. And so you come out, and you're a different person.
You mean not all
sometimes you remember, what's that?
You mean that not all doctors are great?
Oh my God, could you believe it? No, and doctors don't think that they're great. I don't think generally, and I'm speaking for a large group of people. But my point is that with this company, I'm trying not only to give the patients some power back, but I'm also trying to give doctors the power back. To take, no offense to any third-party companies, and we're all third-party companies, third-party companies have ripped our healthcare system dry, insurance companies and things like that. No offense to insurance companies, and what we need to do is I feel, the lights went on, that means I'm finished here. I think we need to give the focus back to patients and doctors and let them get on with it. And all this stuff is important, and research is very important. And looking up your own health care, yeah, you should look up your health care before you go see a doctor. That's the most ridiculous thing if you don't. Why would you not do that, right? And then when you talk to your doctor, you should have some skepticism because, medical school is 4 years, residency is however many years, but we learn every single day. And my patients teach me more about cases than ever I would have learned in medical school. And having somebody that can actually have a dialogue with you is fantastic. And then you know what? Sometimes you educate people, and sometimes people come in and they tell you, oh, I know this, I know that, and the other thing, and you just know that they're not